Hello, I'm Dr. Craig Escude, President of Intellectability, formerly known as Health Risk Screening. Welcome to Medical Monday. So today we're going to talk a little bit about the book, Clinical Pearls in IDD Healthcare. So this is a book that I wrote that's really a culmination of many years, many challenges that I've experienced providing healthcare to people with severe and profound levels of intellectual and developmental disabilities. I realized how little I knew, and I also realized how little information was out there in terms of healthcare and healthcare issues that people with disabilities face. I put together, let me tell you what a clinical pearl is first. A clinical pearl is a term that we use in the healthcare field that really is just a bit of helpful information that's usually gained by experience. So it's a little pearl of information that it's like, hey, this is a great thing to know. This will help me. And so I thought about all of the things that I've learned through the years, and I put them together in this one book. And I wrote the book in a way that it's beneficial for anyone and everyone who touches this field at all. I wrote it first because, the first thought that I had in writing this is that I wanted to write something that would help communicate healthcare issues to healthcare providers, because we know that many healthcare providers don't have the training or the background and don't necessarily understand a lot of the nuances, as I didn't, in providing healthcare for people with disabilities. And I had to learn them the hard way. And there are people who support people with disabilities and have done so for many years who understand that, hey, every time this person experiences pain, he bites his arm, there's something wrong, and we need to figure out what it is. And they can't necessarily communicate that in a way that a healthcare provider might understand or even take them seriously, unfortunately. So the book was written so that supporters can go through the book, and let's say they're having a particular issue related to I don't know, let's just pick one of these things. How about aspiration? And they think the person is aspirating, and they take them to the healthcare provider, and they can't really communicate to the healthcare provider in a way that this person needs to be evaluated for recurrent episodes of aspiration. They can take this one clinical pearl out in aspiration, pop it out of the book, and we allow people to copy these, and they're very succinct 1 or 2 page documents that they can copy, take to the healthcare provider, and give them some basic information about how aspiration might look in people with disabilities. So that's how the book is really meant to be used. It's perfect for anyone who works in this field, and any family member and any person with a disability as well, to learn about some of the basic medical conditions, the basic medical systems of support, and to be able to communicate that to other healthcare providers. It's a great resource for healthcare providers as well, too. The book is in 4 different sections. So there's information on general supports, and it even goes as far as explaining just what is a residential agency, because many healthcare providers don't understand that concept. So it tells them very quickly, hey, this is an agency, this is how this person receives support for daily life. It talks about how to improve compliance with medical procedures, because we know that can be an issue sometimes. It covers some very important topics, things like quality of life, where we know that quality of life, sometimes healthcare providers don't appreciate that people with disabilities certainly do have a quality of life, or think it's much lower than it is, and then that affects the way that they provide care. So there's a pearl about that, and about understanding that different quality of life does not equal a lower quality of life. So that's some of the things in general support. There's a section on medical support that talks about specific medical conditions. One of my favorites is about the way that different behaviors can indicate specific underlying conditions. Then the next section covers behavioral and psychological supports. We know that many people with disabilities have co-occurring mental health conditions. Many of them are on many psychotropic medications that can cause additional problems as well. So there's a whole section with several pearls that talk about mental health conditions, the importance of accurate diagnoses, the concern about overprescribing of medications and polypharmacy, and how to safely prescribe medications. So again, a whole section of behavioral supports. And then the last section covers nutritional supports, because there are things that can be done to help improve the way people eat, to reduce the risks of aspiration, to improve bowel function, simply with positioning and support and other types of nutritional components. So that's a little bit about the book, Clinical Pearls in IDD Healthcare. You can find the book on our website at replacingrisk.com in our store section. And it's available hard copy, and it's also available as an ebook. And over the next several Medical Mondays, what we're going to do is touch on a number of these specific clinical pearls and go into a little bit more depth. So I hope that you continue to join us on Medical Mondays.
Hey everybody, thanks for checking out this episode of Medical Mondays with Dr. Craig Escude. We'll be back next week with a brand new episode and a brand new topic. So make sure to go down below and hit that subscribe button. We're also working on some new episodes for you guys, as well as putting out the podcast every week. So thank you all for watching, and we will see you next time.